Hi, I'm Dr. John Neustadt, president and founder of NBI, and today I'm talking to you about a subject that a lot of people don't want to talk about, and that's gut health. Especially, they don't want to talk about the problems that they might be having around their gut. Gas and bloating, postnasal drip can be caused by problems in the gut. Nausea, fatigue, all of that could be coming from problems in your intestines that you're actually contributing to. And I'm going to talk to you about what those are, what's going on down there, what you may be doing to be hurting yourself, and just as importantly, what you can do to help reverse any problems you're having in the gut related to what's called gut dysbiosis. Dysbiosis means an imbalance in the gut organisms. There are over 1,000 species and millions of genes from those organisms in your gut. There are actually more organisms in your intestines, in your gut, than there are cells in your entire body. It's so important and so large that it's sometimes been referred to as the forgotten organ. Now, it interacts with your immune system and the intestinal lining because the largest amount of immune cells in your body is actually lining the intestinal tract. You have to have a good, healthy mix of gut bacteria and gut organisms to maintain your health. They're important for immune system health. They're important for fighting infections, for fighting the bad bacteria or the bad organisms that may get into your intestines. They can help kill them. They're important for producing nutrients. Your gut bacteria can produce vitamins such as biotin and short-chain fatty acids such as butyric acid, and those are important. Without gut bacteria, healthy gut bacteria, we would be dead. We couldn't survive. It's a very symbiotic relationship. When there's an unhealthy balance of good and bad gut bacteria, it's called, as I mentioned, dysbiosis. And what can happen when there's a lack of good, healthy bacteria? Well, you can get more infections. That's when you can get gas and bloating. You can get postnasal drips of dripping down the back of your throat. Fatigue after eating can be caused by gut dysbiosis. Brain fog, just that feeling of, especially after you eat, difficulty processing information. In severe cases, you can get migratory joint pain. That's where pain moves around from joint to joint over time. Migratory rashes, where the rash comes and goes in different parts of the body. And headaches. And gut dysbiosis can also cause diarrhea. Nothing that anybody wants to have. And yet, unfortunately, too many people are causing this problem themselves. The top 3 causes of gut dysbiosis are medications, your diet, and stress. There are medications that literally people spend in the US billions of dollars a year on. Antibiotics will kill both indiscriminately the good and the bad bacteria, creating a situation for gut dysbiosis, a situation for the bad bacteria to thrive and replicate and take over. A lot of people know about that, but one thing a lot of people don't know about are the other medications, acid-blocking medications, the proton pump inhibitors, the H2 blockers. They go by names of Prilosec, Protonix, Zantac. They can create a gut dysbiosis because in suppressing the acid in your body, it can allow harmful bacteria to get in your body through food, pass through your stomach and into your intestines. One of the roles of stomach acid, is to kill unhealthy or potentially harmful bacteria. And when you suppress that with a medication, an acid-blocking medication, it can create a situation for gut dysbiosis to occur. And in fact, these medications, the proton pump inhibitors, those acid blocking medications, were never approved by the FDA for long-term use. And yet people are taking them for months and months and even years. They're available over the counter now without a prescription. Research has shown that not only can they cause gut dysbiosis, but they can increase the risk for osteoporosis and osteoporosis fractures by 40% and up to 60%. They've been associated with increased risk of dementia and cancer. Other medications also can contribute to gut dysbiosis. Metformin, the diabetes medication, antipsychotic medications, pain medications like ibuprofen, Tylenol, naproxen. Those have an indirect effect because they can damage the lining of the intestine, the intestinal cells, which creates an unhealthy environment in the intestines, and that can provide a situation for unhealthy bacteria, unhealthy organisms to thrive. Not a good situation. The great thing is that there are things that you might be able to do for all of those medications, either to help you reduce them through diet and lifestyle changes, by seeing an integrative healthcare provider who might be able to walk you through ways to change what you're doing, maybe take some dietary supplements to promote your health instead of taking medications to suppress symptoms. And then importantly also, diet. Because diet is another thing that a lot of people are doing, having a poor diet that's contributing to and causing their gut dysbiosis. The standard American diet is very nutrient poor, unfortunately. It's very poor in fiber, it's very poor in vitamins and minerals, and it's very rich in unhealthy fats and food additives. And research has come out showing that that dietary pattern, that way of eating, contributes to gut dysbiosis, and in fact has been associated with an increased risk for intestinal infections. Fiber is such an important nutrient that too many people aren't getting enough of, because the healthy bacteria take that fiber and they create that short-chain fatty acid I already mentioned, butyric acid or butyrate. And that fatty acid helps the cells of the intestine to heal and to flourish. It's a great nutrient that our body can produce with the healthy gut bacteria when we're eating properly. And the last category of things that you may be doing to create your own gut dysbiosis and your own gut problems is stress. Whether it's psychological stress or physical stress, through lack of sleep, through being overcommitted, which so many people are, go, and never allowing the body to really rest and relax, that stress, that high level of chronic stress, modulates the immune system. In the gut, what that does is it decreases an immune protein called secretory IgA. Secretory IgA, when that is depleted or not being secreted enough, since that is an immune protein used to fight infections in the gut, it can provide a situation where we are more prone to intestinal infections, to killing off our good healthy bacteria and for the bad bacteria to take over. And all those symptoms I mentioned before, gas and bloating, postnasal drip, headaches, brain fog, fatigue after eating, migratory joint pain, migratory rashes, diarrhea, all those things to possibly happen to you, which is a real shame. Nobody wants to live that way. Fortunately, though, there's lots you can do about it. I'm going to post below a link to an article that I wrote, a blog, top 3 gut killers and what you can do about it. And in that blog, there are links to other resources on the MBI website about what you can do to take charge of your health, improve your gut health, improve your overall energy, mood, focus, how you feel, and just help you to feel fantastic, because it's spring and summer's right around the corner. So who doesn't want to feel fantastic? Look for that link. I'm going to post it below. And within that blog, there are links to other resources on the MBI website, nbihealth.com, as well as information and products to help you feel your best. Have a great day. Bye-bye.